HR Service and ERISA Solutions is excited to announce the addition of our new Hipaa Compliance Toolkit for all our HR Service clients and organizations covered under our Compliance Basic Services by their insurance brokers. Before I introduce you to the new Hipaa Toolkit located inside our web-based tool accessed by logging into our services, I'll first talk a little bit about Hipaa and what it is and help you understand to what level your organization might be required to comply. Hipaa stands for the Health Insurance Portability and Accountability Act. It was originally passed to protect individuals leaving one company and starting with another without having them required to meet a pre-existing condition in order to get coverage under their new employer. The law, of course, since has been expanded, providing provisions to protect individuals' personal health information, along with the rules governing security for storage, transfer, and transmission of individuals' protected health information. This is called the high-tech rule. Employers first must understand to what level Hipaa applies to them. For covered entities, there are more stringent or strict requirements versus an entity that is not covered or may only be covered to a limited extent. Today, I'm going to focus more on the health plans category because this is where most of our employers, our clients, are going to fall. These are the employers who offer a medical insurance plan to their employees. Other categories include healthcare providers and healthcare clearinghouses. Most of our employers will assume a certain level of responsibility under Hipaa. It's a good practice to just simply have in place methods for protecting our employees' personal information, including health information, as well as other identifiable things like Social Security numbers. Now, if you're a healthcare provider or a medical office or something like that, an insurance broker, you would have a great level of responsibility under Hipaa. You'd have many more steps to take to ensure compliance, many more things you have to put in place to make sure that you're following all of the required steps to be Hipaa compliant. Employers who are offering health insurance have different levels of responsibilities depending on the size of the group and whether or not their plan is self-funded or fully insured. Today, I'll focus mainly on fully insured plans, as I said, employers who offer an insurance plan to their employees through another person like Select Health, Aetna, Blue Cross. This is where vast majority of our clients are going to fall. So protected health information, I mean, essentially what it is it's any type of individually identifiable health information that is held or transmitted by a covered entity or its business associates in any form or media. So whether that is electronic paper or orally, individuals talking back and forth, the privacy rules require that we ensure that it is protected. So our practices need to make sure that everything we're doing to protect the individual's personal information is being taken. So some of the employer requirements under Hipaa in the category of healthcare is going to be to assign a HIPAA privacy and security officer. This is someone who will ensure that your practices and procedures are in place and followed to protect individuals' health information. It's going to be a single point of contact who will continually monitor that environment. They need to provide a notice of privacy practice. Our Compliance Basics all-in-one employee notice includes that privacy notice for these types of employers. You'll determine and track any use of protected health information. You'll ensure proper handling of protected health information. So if we have individuals within the organization that are going to be processing paperwork, we want to make sure that they keep it secure, that they are destroying it in a secure method, that when they're talking to someone else, whether it's another person within the business or a vendor outside of the business, that we're doing it in such a fashion that we aren't sharing someone's protected health information to others without knowing it. We want to protect and secure personal health information through firewalls, password use, encryption. We want to make sure all of our processes take that into consideration. We want to ensure a business associate is in place, a business associate agreement is in place for all of the individuals we work with in providing those benefits. So our benefits providers, any third-party vendors that might be processing billing for us, we want to ensure that they're all doing, to the extent they have to, everything they need to be HIPAA compliant, and these business associate agreements are what we ask them to sign to let us know that they are HIPAA compliant. We want to make sure that we work with vendors who care enough to be HIPAA compliant so that we don't have that fallback on us as employers when something goes wrong. You want to create a privacy, security, and breach notification policy, if applicable. Most employers aren't going to have this type of scenario, but if you have a lot of personal health information, if you're a self-funded plan where you're taking in all of that information, processing on your own, possibly sending it out to a third-party vendor for claims approvals and stuff, you're likely going to be touching and accessing a lot of protected health information and transmitting that back and forth. You definitely need to have in place breach notification procedures and policies. From here, we're going to go over to our website, and I'll introduce you to that tool and let you take a look at what that looks like. So from our HR Services homepage here, what you'll see is the various service offerings we have. Those individuals on our basic compliance basics services or HR support services can access the Hipaa Tool Kit through the compliance basic portal, which can be located by signing in up here in the corner or through the Member Services tab, which will give you another login window. Once you've put in your username and password to enter into the system, this is what you'll see. Across the top here, all the various tools available to you. As I indicated, the Employee All-in-One Notice, this is where your privacy notice is going to be generated. There are other things like past legal updates, HR forms, bulletins, other services that we offer. If you've purchased them, they will be along this tab, like your summary plan description, wrap documents, summary material modifications, or premium-only plans. If you've purchased those services or they've been purchased for you, a tab will appear at the top. Today, we'll focus on the Hipaa Tool Kit, which is available to all our compliance basics clients. Under here, the first page we'll go to is a quick, brief description of covered entities, whether or not you fall into that category. What does that look like to you? So the categories they fall in, and then a brief synopsis here. Covered plans. In general, most employers, those who offer fully insured health benefits, like medical, dental, FSAs, etc., to their employees, they're going to fall into the health plan category under HIPAA regulations. However, your level of HIPAA requirements depends on how you maintain and transmit and receive the protected health information. Organizations can greatly minimize those requirements by restricting their personal involvement in the handling of this PHI. And as long as the company doesn't keep, transmit, or receive PHI, their level of HIPAA obligation is minimal. So some of the steps you want to take, if you fall into that category, are listed right here. Compliance steps. As I indicated before, you're going to define a privacy officer. They're the individual that's going to oversee these various steps here. And you'd walk through these individual steps. There aren't a lot of them, but you'll want to make sure that you go through these steps, review your practices and procedures, and make sure that you're doing what you need to be HIPAA compliant. To help you do that, we offer a tool, a covered entity HIPAA guidance and assessment findings document, and I'll take you to that in a minute. That'll help you walk through that, document that process. Down below, we talk a little bit about non-HIPAA policy or plans, etc. So if you as an employer, you don't offer medical, dental, vision, FSAs, but you have short-term, long-term disability, workers' comp, accidental death, you have a few of these non-HIPAA plans, you wouldn't be held to HIPAA requirements. So this just kind of lists some of those plans that are not held to HIPAA requirements. Then down here, we start getting into the ones that are held to full HIPAA compliance, for lack of a better word. These are going to be the organizations that have a lot of access to, they work with or interact with personal health information on a regular, ongoing basis, like your medical offices, businesses in the medical field, your insurance providers, your brokers. They are constantly in touch with and accessing or have access to protected health information. They're going to have a great deal of steps to go through to be HIPAA compliant. And we walk through those down here. I'm not going to talk about them today in this presentation, but as you can see, they're listed out here. And there's an extensive level of steps they have to go through. And then, of course, you'll see highlighted or bolded several of the tools that we have available for them to walk them through that service, or excuse me, that assessment. So from here, let me take you over to the HIPAA Forms, Documents, and Policies page. Here you'll see a list of the various forms, documents, and tools that we have available to you. Every one of these active links opens a Word version of this document, which will allow you to customize, document, and go through the process very easily. I'm going to focus on the HIPAA Privacy and Security Policy and Procedures document sample that I referenced earlier. This document is the one that you're going to use to assess your business's extent or level of HIPAA protected health information use within your business and HIPAA compliance. What you'll see on this document is you'll just go in and customize it with the various information, so the name of your organization, of course remove the word sample. You're going to indicate who your privacy officer is and their contact information. Then you'll go through each and every step on here. Some give you the requirement, but if your practice is actually more extensive or more comprehensive, you'll want to capture that in here as well. So you would review this to say, okay, at least I'm meeting the minimum requirement in here, like additional risk assessment may be necessary each time new software or hardware is acquired. So as a business, you want to make sure that you're doing that when new service or procedures are initiated. So here it defines a couple of those steps when you want to reassess that HIPAA handling or protected health information handling. If you do it to a greater extent than is listed here, add those in. Down here, policies regarding physical access to the building. You want to document your physical work environment and how that is protected from access, outside access from individuals who shouldn't have access to individuals' protected health information, how we prevent that, like locked doors, security keypads, keys, certain hours of business. You may have a receptionist that prevents individuals from just freely walking into the business and back into rooms where they shouldn't, locked file cabinets, offices that are locked when individuals are not in the offices. So you want to document all of those physical elements that you're going to use to ensure that someone doesn't come in and get access to, whether it's internal within the business or outside individuals coming in, but preventing access to an employee's protected health information. I won't walk through every step here, but you'll see as you go down through the document, it just talks about the various categories from which you need to assess and then document everything that you as an organization or business is going to do to ensure that your practices will protect the employees' health information and be compliant with HIPAA. We get into business continuity. This is your disaster recovery plans. HIPAA breach notification. This would only be applicable if you are handling protected health information on a regular daily basis. You'd want to make sure and capture that here. If it isn't, you want to indicate that you don't have access to or use of HIPAA to that extent, or that you don't transmit or receive protected health information. Sanction policies, these are going to be the steps you would take if an individual violates a policy, your HIPAA policies and training, your retention policies, your destruction policies. So you'll go through this and you'll document everything that you're doing to ensure HIPAA compliance. You'll save this in a folder or in a file so that should they come in to audit your business for your HIPAA practices, you can pull this out along with any associated documents like records of individuals who have been trained, what they've been trained on, the dates they were trained, making sure that you're training on an annual basis or biannual basis that you're training new employees to have access to, or should have access to, or may have access to. So you want to document all that stuff and just keep that with this to protect yourself in an audit environment. In a nutshell, that's our Hipaa toolkit. I hope you will find it helpful.